Right now, as you are watching this, your kidneys are filtering your entire blood supply. Every drop of blood in your body passes through them roughly once every 30 minutes. They process approximately 200 liters of blood every single day, extracting waste, balancing electrolytes, regulating your blood pressure, controlling your fluid levels, producing a hormone that tells your bone marrow to make red blood cells, and activating vitamin D so your bones can absorb calcium. They do all of this continuously, silently, without a single sensation that would tell you they are working or that they are struggling. And that silence is the most dangerous thing about them, because by the time your kidneys send you a signal you can actually feel swollen ankles, persistent fatigue, shortness of breath, changes in urination, a foam that appears in the toilet that was not there before, you have typically already lost 60 to 70% of your kidney function. Not 10%, not 30%, 60 to 70. The damage is that advanced before the first clear symptom appears, and in clinical practice, that is the moment when options narrow dramatically. I have sat with patients who came in for something routine and left with a kidney disease diagnosis that had clearly been developing for years during which a specific, daily, entirely fixable behavior had been quietly accelerating the damage. They were not doing something reckless, they were not ignoring obvious warning signs. They were doing something so ordinary, so normalized, so completely unremarkable that it had never once occurred to them that it could be harming their kidneys. And that is exactly what makes it the number one mistake, not its severity in isolation, its invisibility combined with how universally it is practiced. Today I am going to show you exactly what that mistake is, the specific biological mechanisms through which it damages kidney tissue over time, how to know whether it has already affected you, and precisely what to do to stop the damage and support recovery. Everything I am going to tell you is grounded in published research. Nothing is speculative, and by the end of this video, you will understand your kidneys in a way that most people, including many, who have been told their kidney numbers are slightly off, never have. My name is Dr. Sarah Monroe. I spent 12 years in internal medicine. Kidney disease was one of the conditions I saw most consistently underestimated by patients, and most consistently caught too late. Not because the signs were absent, but because the signs were invisible to the person living with them, and because the cause was something nobody thought to mention. That ends today. Before I tell you what the mistake is, I need to give you a brief picture of how your kidneys actually work, because once you understand the mechanism, the damage will make complete sense. Each kidney contains approximately 1 million tiny filtering units called nephrons. Inside each nephron is a small cluster of capillaries called the glomerulus, a dense tangle of blood vessels so fine that they can filter individual molecules from the blood passing through them. The glomerulus is surrounded by a cup-shaped structure called Bowman's capsule, which collects the filtered fluid and begins the process of reabsorbing what the body needs and excreting what it does not as urine. This filtration process is pressure-dependent. The blood flowing into the glomerulus is under carefully regulated pressure, high enough to force fluid through the capillary walls for filtering, low enough to prevent damage to those walls. When that pressure is consistently too high, the delicate capillary walls of the glomerulus begin to thicken and scar. When they scar, they filter less efficiently. When enough glomeruli scar, kidney function declines. When kidney function declines past a certain threshold, it does not recover. Nephrons, unlike many other cells in your body, do not regenerate. What is lost permanently. This is why the prevention window matters so much. And this is why the number one mistake is so consequential. Because it operates directly on glomerular pressure, day after day, silently, in a way that is entirely within your control to change. The number one mistake destroying your kidneys is chronic underhydration, not severe dehydration. Not the dramatic kind where you feel dizzy and your mouth is parched and you know you need water. Chronic, low-grade, daily underhydration, the kind where you feel basically fine, where you are not thirsty in any alarming way, where your urine is yellow rather than clear, but you do not think much of it, and where your total fluid intake is consistently 40 to 60% below what your kidneys need to function without strain. Research suggests that the majority of adults in developed countries are chronically mildly dehydrated for most of their waking hours, not because of unusual circumstances, simply because drinking adequate water has not been built into their daily routine. They drink coffee in the morning, perhaps a glass of water with meals, and move through most of the day in a state of mild fluid deficit. That they have normalized is simply how they feel. And here's what that mild, normalized, entirely unremarkable fluid deficit is doing to their kidneys. When your body's fluid level drops even modestly, your kidneys receive a hormonal signal to conserve water. This signal activates a system called the renin-angiotensin-aldosterone system, the RAS. This is your body's emergency pressure management network. When the RAS activates, It triggers the kidneys to retain sodium and water, and it causes the blood vessels supplying the kidneys to constrict. Constriction of those vessels raises the pressure inside the glomeruli, and as I just explained, elevated glomerular pressure damages the capillary walls over time, contributing to the scarring that permanently reduces kidney function. In a healthy body that experiences occasional dehydration and is properly rehydrated afterward, the ROS activates briefly, does its job, and quiets down when fluid balance is restored. No lasting damage. This is a system working as designed. The problem is what happens when dehydration is not occasional but chronic, when the ROS is not activated briefly but persistently activated every day for years. In someone whose baseline fluid intake is simply never quite enough. In this scenario, the glomerular capillaries are under chronically elevated pressure day after day. The scarring accumulates slowly, silently, and irreversibly. Kidney function declines at a rate that exceeds normal age-related loss, and the person living with this has no idea, because they feel fine. A study published in the Clinical Journal of the American Society of Nephrology found that low fluid intake was associated with significantly faster progression of kidney function decline in people with existing chronic kidney disease. But the implications extend beyond those already diagnosed. The same mechanisms, chronic ROS activation, elevated glomerular pressure, progressive scarring, operate in people with no diagnosis over years of insufficient hydration, laying the groundwork for a kidney function problem that will not be caught until it is advanced. There is a second mechanism through which chronic underhydration damages kidney tissue, and it is one that most people have never heard of. When fluid intake is consistently low, urine becomes concentrated. Concentrated urine contains higher levels of uric acid, a metabolic waste product generated primarily from the breakdown of purines in food and from normal cellular turnover. In adequate urine volume, uric acid remains dissolved and is excreted without issue in concentrated urine. Uric acid can precipitate, crystallize within the kidney tubules. These crystals cause direct physical damage to the tubular cells that line the collecting system of the nephron over time. This tubular injury contributes to a pattern of kidney damage called uric acid nephropathy, which progresses silently and is frequently overlooked because it does not show up on standard kidney function tests until significant tubular damage has already occurred. This is the same chemical process that causes gout, the painful crystal deposition in joints that people associate with high uric acid. But the kidney version happens without pain, without symptoms, without any signal that something is being damaged. It is a silent companion of the silent killer. The third mechanism is one that connects directly to content I have covered in previous videos on this channel, and it is important enough to discuss here in the context of kidneys specifically. Chronic blood sugar instability, the pattern of repeated glucose spikes and elevated average blood sugar over months and years, is one of the most powerful drivers of kidney damage that exists. Elevated blood glucose damages the small blood vessels throughout the body, and the glomeruli of the kidneys are among the most vulnerable of all. Glucose-damaged glomerular capillaries become leaky. They begin to allow proteins to pass into the urine that should be retained in the blood. This protein leakage, called proteinuria, is both a sign of existing damage and an active contributor to further damage, because the protein itself is toxic to tubular cells when it appears in the urine in abnormal quantities. This is why people with diabetes and prediabetes have dramatically elevated risk of kidney disease, and it is why the bedtime habits, the morning routine, and the blood sugar management strategies I have discussed in other videos on this channel are not just about energy and weight. They are about protecting the glomeruli that will determine how well your kidneys function in your 60s, 70s, and beyond. So what does adequate hydration actually look like in practice? And how do you know whether chronic underhydration has already affected your kidneys? The most reliable, most practical indicator of your hydration status at any given moment is the color of your urine. Pale yellow to almost clear urine throughout the day indicates adequate hydration. Dark yellow urine in the morning, which is normal after a night of sleep, should lighten significantly within the first hour of waking as you rehydrate. If your urine remains dark yellow or amber through most of the day, your kidneys are consistently concentrating urine and the RAAS is being chronically activated. That is the signal. The general recommendation of 8 glasses of water per day is a reasonable starting point, but an imprecise one because hydration needs vary significantly based on body size, activity level, climate, diet, and the diuretic effect of what you drink. A more accurate approach is to aim for urine that is pale yellow by mid-morning, and remains so through most of the day. That color tells you your kidneys have adequate fluid to work with, and are not under concentration stress. Timing also matters in a way most people do not consider. Your kidneys filter blood continuously, which means they need a steady fluid supply throughout the day, not a large amount consumed all at once. drinking 2 liters of water in the evening after a day of inadequate intake does not undo the hours of concentrated urine and ROS activation that preceded it. The goal is consistent intake distributed across the day. A glass upon waking, a glass before each meal, a glass in the mid-morning and mid-afternoon, and modest intake in the evening without overloading the kidneys before sleep. What you drink matters significantly alongside how much. Coffee and tea, while they contribute to total fluid intake, have mild diuretic effects that partially offset their hydration value. They are not substitutes for water. Alcohol is a potent diuretic that suppresses antidiuretic hormone and causes significant fluid loss. A single glass of wine before bed can leave you net dehydrated by morning, which connects directly to the elevated fasting blood glucose I discussed in a previous video. Because dehydration and ROS activation both raise cortisol, and cortisol raises blood glucose overnight, sugary drinks and fruit juices contribute fluid but impose a metabolic cost. The sugar load drives the inflammatory and metabolic processes that damage glomerular capillaries through the blood sugar pathway I described. The most kidney protective fluid, by a considerable margin, is plain water, and the most kidney protective dietary pattern complements adequate hydration. By reducing the uric acid and inflammatory load that concentrated urine must carry, reducing red meat and organ meats, which are high in purines and drive uric acid production, reducing high fructose foods, which increase uric acid synthesis through a specific metabolic pathway, increasing the proportion of vegetables and fruits with high water content, cucumber, celery, watermelon, leafy greens, which contribute to fluid intake while providing anti-inflammatory compounds that support the blood vessel health of the glomeruli. There is one more thing I want to address before we close, because it is a question most people have at this point and do not ask. How do you know if your kidneys have already been affected? The answer is a blood test called the eGFR, estimated glomerular filtration rate. This single number tells you what percentage of normal kidney filtering capacity your kidneys are currently operating at. A value above 90 is considered normal. Between 60 and 90 indicates mildly reduced function, the stage at which lifestyle intervention is most powerful and most effective. Below 60 indicates moderate impairment and warrants close medical supervision. Below 30 is severe. Most people who have readings between 60 and 90 have never been told the number or what it means. Ask your doctor for it by name. Know your eGFR the way you know your blood pressure. Because unlike blood pressure, kidney function decline does not announce itself with symptoms until it is advanced. And alongside the eGFR, ask for a urine albumin to creatinine ratio, the ACR. This test detects protein in the urine before it becomes obvious. An elevated ACR is often the earliest measurable sign of glomerular damage appearing years before eGFR begins to decline. These two numbers together give you a complete picture of where your kidneys stand today. The number one mistake destroying kidneys is chronic underhydration. It is mundane. It is universal. It is entirely reversible if caught early. And it operates through 3 specific biological pathways: ROS activation and elevated glomerular pressure, uric acid crystallization and tubular damage, and the blood sugar pathway that damages glomerular capillaries directly. All 3 are addressed by the same simple, free, immediately available intervention: water. Adequate, consistent, well-timed throughout the day. Your kidneys have been working for you every minute of your life without asking for anything. They are asking for something now. They are asking for enough fluid to do their job without strain. Give them that, and they will serve you far longer than they would otherwise. I want to hear from you in the comments. Do you know your eGFR number? Have you ever been told your kidney function is slightly reduced and wondered what to do? Tell me where you are, and I will make sure the next video speaks directly to what you need. Every comment shapes what gets made here, and I read all of them. If this video gave you information that changed how you think about something, as simple as drinking water, please share it. Someone in your life is living with this mistake right now and has no idea. That share could be the most valuable health intervention you make for them this year. Subscribe if you have not already. This channel exists to give you the science behind the signals your body sends before those signals become emergencies. There is more coming, and it connects to everything we have already covered. I am Dr. Sarah Monroe. Your kidneys have been silent. Now you know what they need you to hear.